So today, Premier Doug Ford announced who will be behind the commission investigating the deaths of nearly 2,000 seniors in long-term care.
They're going to have free rein to summon anyone, to make recommendations, not make recommendations. But I want to get down to the bottom of this. I really do. We're fixing the problem from now till then, and we're going to continue fixing it. But I need answers. I want answers. You know, I want this commission to move forward. We're going to fix it and make sure the people in long-term care are going to have a quality life in long-term care.
The three-member commission will be led by Associate Chief Justice Frank Morocco, who was the provincial government's lead counsel during the Walkerton water inquiry. The opposition has called for a public inquiry instead and is criticizing the Ford government for not allowing the commission to reach conclusions about civil or criminal liability, saying that will potentially give immunity to long-term care homes if they are found to be negligent. Close to 2,000 vulnerable seniors dead. What went so wrong? The answer to that question is obvious to those who have worked in long-term care. They've been sounding alarm bells for years, but it's only now people are actually paying attention. I spoke with a personal support worker about what needs to be fixed. I'm protecting her identity because she fears she could lose her job for speaking out.
We lost over 20 residents. I was petrified.
She has been a personal support worker for over 16 years. When COVID-19 struck, it revealed an ugly truth she's always known. Long-term care homes are painfully understaffed.
Was begging me to take her home. Begging me.
Families were fearful their loved ones weren't getting proper care, and in many cases, they weren't. This PSW says there were times during the height of the pandemic she would be caring for 30 residents, all by herself.
One PSW for 30 residents, if you're short?
30, yes, 1 to 30.
But chronic understaffing in long-term care homes was a problem long before COVID struck. In 2018, Unifor, the union that represents PSWs, said the workers have an average 6 minutes to get a resident up and ready in the morning. Imagine doing all this in 6 minutes.
You would wake them up, get them out of bed, get them to the toilet, get them dressed, brush their teeth, groom them, toilet them, get them up in their wheelchair, get them out for breakfast.
How is that possible?
It's not.
And keep in mind, these are elderly residents with high needs. According to the Long-Term Care Association, 90% of long-term care residents in Ontario have some form of cognitive impairment. 2 out of 3 have dementia. 86% need extensive help with activities like eating or toileting. And while the time-consuming needs of individuals have been rising for years, staffing has not kept up. But understaffing is only one issue.
We need smaller homes with more staff, more dementia supports, and better infection control.
And how about a national strategy to set the standard? Because there isn't one. There's no standard.
Advocates like us at CanAge and many other colleagues have been calling for national quality standards for years.
Unifor has also put out this ad calling for an end to privatized long-term care homes. Data has shown the COVID death rate in private long-term care homes has been higher than nonprofit or municipally run facilities. But there also needs to be a culture shift on how seniors are valued. Long-term care resident Devora Greenspan says she has felt overlooked.
They have to realize that we can contribute.
All issues the commission will hopefully examine. Its report is due April 2021, but that could come well after a second wave. Many wonder how strained homes could possibly cope with another COVID strike.
Do you have the strength to go through it again?
I don't think so. Because when you see the residents suffer the way I have, and you put them in body bags and you tag them as COVID positive, it changes you.
Wow.
That's traumatic.
The lack of full-time hours, which force PSWs to work in multiple homes, is also another issue and a contributing factor in the spread of COVID-19. The PSW I spoke with says she worked at 2 long-term care homes in order to support her family. She works 75 hours a week.